Back to the basics, IEP. There are numerous acronyms thrown around in special education. One of the most common ones is IEP. IEP stands for Individualized Educational Plan or Program. An IEP is a legal written document developed with input from the student's parents and special education professionals for any public education student that is eligible for special education services. This document is reviewed at least once a year. Each year, a student's IEP will be reviewed during an annual review meeting. All members of the student's special education team, including the parents, are invited to participate. The purpose of this meeting is to review and report the student's progress on goals and objectives and propose new goals and objectives that reflect the student's current abilities. Additionally, this meeting will address any supplementary aids, accommodations, or modification that may be necessary for the student to access his or her educational environment. While every school district and special education program run their IEP annual review meetings differently, the components of an IEP are the same. The components of an IEP are demographics and attendees. The student's demographic information will be reviewed to ensure that it is up to date. All meeting attendees will sign in on the designated form. If an invited attendee is unable to attend, the parents or guardians will also need to sign an excusal form. Present level of academic achievement and functional performance. This section is the most comprehensive. It will outline the student's strengths, baseline performance on academic skills, as well as identify areas of need. Data should be used to illustrate the student's baseline performance. The educational impact of the student's disability should also be addressed. If the student has an educational diagnosis of autism, the autism consideration must be completed. Parental input, which includes strengths they see in their student as well as their concerns, should also be documented here. It is also important to include any accommodations, modifications, or strategies that have been attempted and how the student responded to them. Transitional planning. By the time the student is 16, transitional planning must become an aspect of the IEP meeting. Some states mandate that training planning begin earlier. Until that time, transitional planning will not be part of the IEP process. This component is to discuss the family and student's plans upon the completion of secondary education. The student's strengths and interests are considered, as well as areas of growth that need to be addressed. This component of the IEP will be a part of every annual review meeting from the time the student is 14 and a half until he or she completes secondary education. Goals and objectives. All special education professionals that provide direct services to the student will propose goals and objectives. The goals and objectives should be considered SMART, which means they need to be specific, measurable, attainable, relevant to school function, and time-bound. The scheduling for progress monitoring should also be indicated. If your state has adopted Common Core state standards, the goals must be aligned to a standard. Finally, goals and objectives should align with areas of need and the baseline performance information documented in the present levels of academic achievement and functional performance. Educational accommodations and supports. This section of the IEP details the specific aids, accommodations, and modifications that are needed for the student to make progress towards the proposed goals and objectives. Additionally, this section outlines the accommodations, supports, and modifications that are needed for the student to access the general education curriculum. In addition to providing information on the specific accommodations and supports, the special education professional responsible for the support will be documented. There are 5 specific areas that must be addressed on all IEPs. They are assistive technology devices and services, communication needs, limited English proficiency, blind and visually impaired, and behaviors that impair the student's learning or that of others. This section must also address cultural and linguistic accommodations. Finally, this section will also address any support service personnel may need. Completion of the training on any necessary supports may be completed by the indicated timeline documented in the IEP. Assessments and assessment accommodations. This section indicates which district and statewide assessments the student will participate in. The special education team will discuss and determine if the student can participate in assessments without accommodations, if accommodations are needed, or if the student will participate in an alternative assessment. Any assessment accommodations must be documented in this section, as well as need for an alternative assessment if appropriate. If accommodations are determined to be necessary, there are 4 categories that will be discussed. They are presentation accommodations, timing accommodations, setting accommodations, and responses accommodations. Educational services and placement. Only after the student's present levels of academic achievement and functional performance goals, supplementary aids, accommodations, and modifications have been discussed can the decision regarding educational placement be made. The special education team, including the parent or guardian, need to consider 3 placements before agreeing on one. To the maximum extent appropriate, the student should be educated within general education. Every student with a disability has a right to a free and appropriate public education in the least restrictive environment. The least restrictive environment will look different for every student receiving special education services. The least restrictive environment is based upon the specific needs of that student. Extended school year during the IEP. During the IEP, discussion regarding extended school year will also occur. Extended school year is considered on an individual basis for each student with an IEP. It's considered regression or loss of skills and recoupment or the time required to relearn those skills. Additionally, it considers critical periods for new skills and the potential loss of essential life skills during breaks from school. Not all goals and objectives may need to be addressed during extended school year. Only goals for which there is a valid concern for significant regression may be targeted. The least restrictive environment may look different during extended school year, as the district may not offer the same continuum of services. These are the basic components of an IEP that will be discussed at an annual review meeting. If you have any specific questions regarding your school district or special education program process, seek out experienced colleagues for your special education administrator.